Welcome to Australia. You've probably had a welcoming. So I'm Anthony Hartcher. I'm a clinical nutritionist and lifestyle medicine specialist. My journey will start in terms of with Kappa, started around 2017, so around 6 years I've been with Kappa, and having students come along and spend time with me, and also helping them in terms of mentoring and giving them a taste of what it's like in the wellness industry of Australia. And certainly I want to give you that sort of taste as to where the Australian wellness system's at, or the healthcare system's at. So you can call it sick care, or depending. So anyway, we're going to talk about the medical system, and then the complementary alternative health as I guess. I mean, they're coming together, which is great, but they have been predominantly separated, and differing views and whatnot. But you're certainly going to be getting an idea of the status in terms of where the medical system's at, the Australian healthcare system that's facilitated by the government. And then I'll talk about certainly that more personalised health and the future in terms of how I see it, in terms of what I've researched as to going forward, and how we can address some of these rising issues within healthcare. I'd love it to be an interactive session, so please feel free to ask questions as I go along, whatever they may be. Happy to answer them. If I can, I will. If I can't, I'll let you know. And I've got my daughter here today, Sophia. So Sophia's studying in the Australian schooling system, about to go into secondary school system, year 7, and so she's just helping me out today. She's my intern. And I thought I'd just start with sharing my personal healthcare journey as to why I'm doing what I'm doing today. So I'm a fully qualified chemical engineer. Okay, so and then I did another 2 more degrees in the field of, I did a degree in health science, majoring in nutrition and dietetic medicine, and then I did a degree in complementary medicine. But my path, what really took me here was due to an early childhood experience where I was very sick as a child. So I was constantly getting sore throats, runny noses, and waxy ear infections, constant ear infections. And so I ended up at an early age, 4 or 5, going in for 2 operations, getting grommets inserted, my tonsils removed, and that sort of really set my journey in terms of I never wanted to be sick again. And hence my path to where I am today is very much because of that big void I had when I was a little kid growing up. I was sick, and so I just didn't want to be sick again. And so it's really served me well in terms of looking at how I can proactively look after my health and well-being and prevent sickness and illness. So that's hence I was really directed by my parents and influenced heavily by them. I went into engineering because that was I considered a well-recognised, well-regarded profession. And then after 15 years in the engineering field, and then also climbing the corporate ladder, I found I was very unfulfilled, and so I went back to this underlying burning desire of mine, and what really inspires me is health and well-being. So that's a little bit about me and my backstory, and essentially this is what we're going to be covering today. This is the outline. So looking at the nutritional status, the exercise in terms of where we're at around movement. You'll be able to see some similarities, and you'll be able to do that contrast and compare. In a sense, we're very much following America. In some areas we might be ahead or further behind, but it's very similar in terms of trajectory. We're actually getting sicker as a nation. You might perceive it differently, and it may be because of the areas that you're visiting, which are more affluent. However, if you go out to Western Sydney, it's a different story out there. And it will remind you of the poorer areas, or not so socio-economically developed areas of New York's state. So certainly we're in a similar, and we have that great divide in terms of the affluent who can afford, you know, complementary and alternative healthcare, that can spend money on prevention, and then we have the other side that, you know, is struggling to make ends meet, and they generally don't have the education that the more affluent do. So we have this sort of great divide in the middle between the two. And essentially, I'm going to be talking about how nutrition and lifestyle medicine can really help, and it really comes, the backbone of it all is education, and hence why I spend a lot of my time facilitating education, because it's empowering others to better look after themselves. So that's, yeah, I actually do most of my career now is doing these talks, and if I'm not talking live like this, I'm doing podcasts or webinars. And then I'm going to talk about my take on the future of nutritional medicine. It'll be interesting to see what your take is. And then certainly Q&A at the end, but as we go as well, so wherever you're at, in terms of your question asking. So this probably won't surprise you at all, this statistic here. So, you know, less than 10% of adults meet the daily consumption for vegetables, and I actually know it's around only 4% of Australians actually hit the vegetable consumption. And again, this is a bit outdated, but it's basically where it's still at today. It hasn't changed a lot. And look at this, in terms of the next point, is 5 to 7 serves of discretionary foods. So what they should be having in vegetables, they're replacing or having as discretionary foods. And then you look at the future is looking grim as well. So the children are also following the trend of the adults. So it's, I guess, what the children look up and aspire to their parents and look for them for guidance. And if they see their parents not eating their vegetables, or their parents, you know, just eating plates of meat and carbohydrates, then the children just copy dad or copy mum, and so it just progresses that way. And the other thing I've really noticed through my time in, you know, I guess my career, is certainly the lack of the cooking skill set. So you're probably aware yourself that we're very much that, you know, that takeaway generation where we go for convenience, we're chasing convenience. And what's essentially been lost is that art of cooking. And so Sophia can certainly relate to we're spending a lot of time with our children to educate them and empower them and how to cook. So is there any questions around this? I think it would be quite similar to the States.
What do you guys think?
Yeah.
Pretty close to us, right?
Yeah. I don't think they eat too healthy in America.
Especially the children. You know, we have a huge epidemic with childhood obesity. It's just funny, we were literally just talking about this on a walk over about cooking and childhood obesity and setting good examples for our kids, eat more vegetables. And just recently, an article was just posted that the Pediatric Association just came out with new terms for treating childhood obesity because it's getting so out of control. You know, 15 million children in the U.S. are obese right now. And they said, which we kind of were in a little disbelief of, that children now 10 and older can be treated with weight loss pills, and children 13 and older can actually get bariatric surgery. So instead of looking at the problem, and they did say in the article, look at behaviors and the parents need to set good behaviors, but in true American way, we're looking for a pill or a quick fix instead of fixing the actual real issue of teaching our kids how to cook, teaching them, showing them good behaviors, changing that behavior in the family home environment versus, you know, that quick McDonald's fix, or we don't have enough time to cook. So they're looking at true American way, looking for that quick fix instead of actually fixing the real issue. So you definitely see some similarities, but in genomics for nutrition, using food to heal your body, healthy food to heal your body and sickness, like your path and journey. It's kind of sad to see we're looking for that quick fix instead of actually looking at the real problem.
You had a question?
Do you think on the food labels, you know how like they now have like they have the grading, do you think that's helping? Because I know in the US, the FDA was talking about implementing it on all the labels, but like the big companies like don't want that because like why would Coca-Cola want an F? Do you think it's helping like people that aren't educated, or do you think it's like people just don't want that? They just still want to like cook?
No, I think people are very influenced by the marketing, and hence why companies spend so much money on the marketing. And I certainly notice that whatever the trend is, that will go on to the marketing of the product. So if like there's a big plant-based movement at the moment, and so a lot of things are saying, you know, vegan friendly or vegetarian or those sort of things. So certainly I think a star rating that we have on our products does influence and certainly has a bigger influence on the uneducated or the not so educated, or because essentially they're relying on those labels to let them know if it's healthy or not. And it's as opposed to empowering that person to actually read the ingredients and to work out themselves whether it's going to help them in terms of their health goals, versus just looking at the star rating. And the star rating again is a very sort of generic system, and it's like they're trying to make a one size fits all, and that doesn't work because as you know, everyone here is completely unique and different, and certain foods will resonate with you and certain foods don't. And so again, these sort of generics, I think they can be misleading as well. So yes, people do buy that, but you know, as to whether I think it's certainly not the solution. It's certainly taking us in a direction that we need to go, but ultimately it really is empowering the kids in the classroom how to read labels. And when I looked at Sophia's health book from school, all her other books are 124 page books, and they're pretty much full. Her health book was about 5 pages that actually worked on health for the whole year. And so that goes to show that how little in terms of the education system is invested around health and well-being. So the exercise stat, just in terms of your point, Martin, so Australia's, it's around 30% of children are obese, and then up to 50% obese and overweight, but very similar statistics, and look at the adults, only 1 in 2 are meeting the physical activity guidelines, so 50% aren't, and then 2 in 3 children don't meet the physical activity guidelines. And you think of the free spirit of children, they love to play and run and stuff like that, and it's really sad to see that there's a third of them that's not doing much, not really getting out and being physically active. So the Australian guidelines is 150 minutes per week of moderate exercise, and recommended to go up to, if it's light to moderate, it's more like 220 minutes per week. And again, if you look at 150 minutes, you divide that by 5, it's 30 minutes Monday to Friday, right? It's not a lot. So the bar's being set really low, and yet 50% aren't meeting the guidelines. And so, you can see how this, inactivity, sedentary, screen-based is very much set in. We're spending a lot more time in front of screens, and less time out and about and moving around. And there's many reasons, like the thing, as you know, with health, it's multifactorial. There's many contributing factors. It's not a direct cause and effect. There's many causations, and it's generally an accumulation of those that really result in illness. So in terms of the health status, chronic disease are really plaguing the healthcare system. And as you know, the driver behind chronic disease is unhealthy behaviours, right? So very preventable, and they happen over time. hence they're chronic. You can see, you know, the list of diseases here. For some reason, this one. the list of diseases here, very similar to what you've probably seen. A lot of cardiometabolic diseases that are certainly, you know, manifesting as a result of not eating well and inactivity. And the stress, there's also a big stress factor that's driving uneasy healthy behaviours, that's causing sleep deprivation, which then compounds itself into not sleeping well at night. And so there is so many factors that are really playing a part here. And look at this, almost half of Australians have one or more of those, you know, of those conditions above. So it's really high. It's and then here, look at in terms of, you know, what's contributing to the mortality. It's 9 in 10. You know, it's just about 9 in 10. 89% is the chronic disease burden. And so as you're aware, the medical system that we're so dependent on here in Australia, which is probably likewise in America, is very focused around acute management. We're very good at acute management, acute care, but where it struggles is dealing with the chronic diseases. Again, as Martin said, the solution is finding a pill to numb the symptoms, to take the symptoms away, but not addressing, as Martin said, the causation. And the only way we can do that is through that education and these movements, such as the I think it was Discovering Wellness. So those sort of movements and this sort of forums and you studying your degrees in health and wellness really starts making a difference in this area. So, like you look at this, 46% is potentially preventable. So we know if we start addressing these underlying drivers that we can really start resolving chronic conditions. Again, unbalanced diet, you know, and they're very focused on these highly processed foods, which are highly calorific, lots of fat, lots of sugar, high salt, very palatable. So people want more of them. They're very desirable foods. However, they're causing us a real imbalance in terms of our physiology. And then compounded with the lack of so you eat a lot of these foods, you start to put on weight. It makes it harder to exercise, to move around, because first of all you don't have the energy and you're carrying a lot more weight, and you know, in hot conditions like this you're going to sweat a lot more, and so there's like the incentive to go out, or the drive to go out, is also diminished. Which results in more sedentary behaviour, and then this compounds over time. Obviously there's the tobacco-related, alcohol-related contributions to these, and again you've got drugs and other addictions. And then you look at the amount it's totaling here in Australia. Again, you know, US is talking in trillions of dollars. We're a much smaller economy, so these would probably translate to trillions in your economy. But you know, 27 billion is a lot of money in our economy. So it's a third. It's consuming a third of our national health budget. And then you look at what the government's doing in order to prevent these chronic diseases, and it's very small in comparison. So 2 billion is spent on the preventative side. Yet we know it's the preventative side that's actually going to resolve or better manage these conditions versus the taking the drugs or doing the surgery. And as Martin said before around the bariatric surgery, well, they keep changing the goalposts in terms of medications, so they keep lowering the threshold at which you get prescribed that pill. So the cholesterol keeps coming down, blood pressure keeps coming down, so they can prescribe more pills. And you know, the drug companies do really well out of it, but it really isn't addressing this underlying drivers behind it. So in terms of the solution, it's probably not, you're not going to hear much here that's sort of not known. It's probably very, so I'm going to share what the government's doing in terms of their National Strategic Framework for Chronic Conditions. So there are actually setting up committees to look at this, to investigate it, to report back, and to come back with policy direction. And you can see here that the vision is good. So it's a good start. Their objectives is good. Promote health. I know Elizabeth's in the health promotion space, public health promotion. Partnerships for health. Again, looking for private and public partnerships. Addressing the critical life stages. Again, nutritional needs are different over the life stages, as you're probably aware. And then making sure you have timely and appropriate detection and intervention. Well, ultimately, the intervention starts as early as possible with, raising children, and then obviously imparting the education and then bringing them up in a holistic wellness world, so to speak. So this is a little diagram that I created. Again, there's different versions of this, but this is very much that holistic approach, and there's probably elements you might perceive that are missing, but I might include it in part of these subheadings. Again, today I'll focus very much on this, but as you're well aware, there's this whole side here too. We know how important relationships are to our mental health and well-being. There's that Harvard study on the longevity study on happiness, and certainly that study has come out with a number of findings, and one of them was that those most happiest in their 80s had the best relationships in their 50s. And the other finding was that loneliness kills, and it can be equated to smoking a packet of 15 cigarettes a day. And then if you look at the stats, and I think this stat comes from the US, is that around 20% of the population are now saying they're lonely. And that's what's reported. So there's another whole element that goes unreported that's not in the statistics. And I think since the pandemic, I think this has only been exacerbated in terms of that feeling of loneliness and the anxiety and mental health issues. And so, this relationship part, plays a big. And then if you look at this world in terms of social media, there's a lot of interaction that's, I guess, not in the physical sense, but in this online, in the web, and we are losing this ability to, connect physically. So this is a big emerging area that certainly needs, addressing, and then the mindfulness. You're probably well aware of the mindfulness movements, and help people to be more present, more centered. That's certainly a big aspect to health and well-being, and sleep has often been overlooked too. So you look at, the government is very much centred around, eating well balanced, moving so much per day. But another area that's very overlooked is sleep, and the effects that sleep deprivation have on what we choose to eat, and how we, and whether we can move our bodies well. There was a study, I think it's by Professor Matthew Walker. He shared this study. I don't know whether he actually conducted the study, but essentially those that were sleep deprived in this study consumed 300 more calories the following day, and that sleep deprivation was defined as around six or less hours a night, and that's sleeping time. That's not time in bed. So again, our sleep efficiency is generally not great because we're lying in bed, we're not actually sleeping. So that's actually time of sleep, 6 hours. So getting less than 6 hours of sleep can drive the propensity to want to consume 300 more calories. And you think that happening over a year of sleep deprivation, how much more kilos that would put on your body. And when you're sleep deprived, you're more lethargic, you're less likely to move your body, and so it compounds. And again, you think about the sleep effect on your relationships. So you're more moody when you're tired, right? So it impacts your relationships. And so this aspect of sleep, again, it's emerging and it's becoming, we're better understanding the importance of sleep and what contributes to a good night's sleep, and how we can support that through a nighttime routine and doing the right things during the day, because what we do during the day affects our quality of sleep at night. So that's pretty much it I had in terms of formal presentation. In terms of the future of medicine, it's certainly personalised. We can see this with where science is going around gut health, and realising that everyone has a different microbiome, and we understand that genetics are different, and so personalisation of health is the future in terms of getting the right health outcomes. How does that translate in a more general population, a broader population? It's difficult from a government point of view. They need to serve the masses, and so but again, technology may help. Certainly, testing of the microbiome is getting far more accurate, far easier to administer, and more cost effective. Then we're starting to understand, I guess, neuroscience a whole lot better, sleep science a whole lot better, and we're starting to, I've got this Aura ring, which is, tracks and measures my sleep. So it tells me, the amount I get in terms of deep sleep and light sleep, and in terms of the sleep stages, my sleep efficiency, my heart rate, and it gives me feedback. And actually, by using this ring, it's really improved my sleep quality. I understand. You can see direct correlations between, consuming too much caffeine or stimulants during the day and how it affects your sleep at night, or eating too close to bedtime, how that really affects your sleep at night, and how exposure to blue light close to bedtime really affects your time to get to sleep. So it measures everything from time you fall asleep, and the different stages, how much deep sleep you get, how much light sleep, and how much REM sleep, and oxygen saturation. So if you're getting impeded airways and you might be mouth breathing as opposed to nasal breathing, it will let you know that certainly your blood oxygen saturation is lower than what it should be, or your heart rate's dropping lower than what it should be. And so these sort of devices are really helping that personalisation of medicine. So certainly there's a lot more of these things floating around. The Apple Watches, again, I've got an Apple Watch here. These are becoming far more, ECGs. I mean, I actually saw a client, and it was his watch that let him know that he was in atrial fibrillation, and it was flashing up. It made him book an appointment with his doctor. He went and saw the cardiologist, and the cardiologist diagnosed him with AF. So it all basically from the watch. And you can imagine if he didn't have that watch, he would have just continued doing what he was doing. Men, in terms of generally don't see or seek help, or in particularly in a proactive sense. And so he may have ended up having a heart attack and dying earlier. But because it's been picked up now, he's now getting the support he needs to better manage his condition. And so certainly these wearable devices are far more available, becoming a lot cheaper, and is really empowering people. So Aura sends me, again, I'm not promoting Aura, I'm just sharing stories and how it's helped me. But they're sharing constant research about sleep science, and so I'm getting more and more educated in sleep science, and my sleep's far better than what it was when I think I've had it for about 2 years now. And certainly the watch is making me more aware in terms of the amount of activity or the amount of inactivity I'm doing in a day. So I've got that more awareness, and again, we've got devices to track, or to track what we're eating and things like that, and to let us know what macro composition, micro composition. And so certainly I think with the way science is heading, personalisation of health is going to be far easier and more accessible. It's just questionable how accessible it can be in terms of that broader, getting to those lower socio-economic areas and helping those people. So that's pretty much it for my presentation. I do a lot of suicide, depression, self-harm, those, yeah, so it's like, yeah, I mean, like if you, like there's areas that are quite affluent, country areas that are quite affluent, and I'd certainly say that's going against the norm, but I'd say that the bulk of the Australian country towns are really, it's prevalent in terms of the obesity epidemic, and you'd probably see a lot worse in the city, and particularly if the eastern suburbs is a very wealthy part of Sydney, and the fitness culture is all throughout, and actually the issue probably more so in the eastern suburbs is under-eating. So there's an eating disorder, but it's under-eating, and then out west it's more overeating, and so yeah, so again, depending on where you're hanging out, and like generally tourism will be centred around the eastern suburbs because you've got the beautiful beaches, the harbour, which has got some a lot of wealth around the harbour because of the water. So these are very wealthy areas, and not indicative of the Australian population. Certainly indicative of the inner city populations, in Brisbane and Melbourne, because that's where there's a higher socio-economic class. But as you get further and further out from the city, similar to what you'd find in New York State, yeah, the health is deteriorating.
People that live outside the city, how hard is it for them to get healthcare and services?
It's improving, but it's not great. Yeah. So there's been a greater investment in terms of hospitals and medical facilities out in these regional townships, and particularly the high population ones are better off, but the remote indigenous areas are really underserviced, severely underserviced, and what they have in terms of availability of healthy foods is also really, there's just not, so their local corner store doesn't have a lot of fresh produce. Again, I'm talking in really remote places, and part of that is because of the remoteness, and by the time the fresh fruit gets there, it's pretty much rotten, or the shelf life is significantly shortened, and so there is a great disparity between, I guess, white Australian and the Indigenous population, and their health is far worse than the statistics I showed today. I mean, they capture the Indigenous population in a separate lot of statistics, and they're really they're just magnitudes, orders of magnitudes worse. Yeah, so it's certainly what you see here is like if you were to go to any remote Aboriginal community, yeah, it's a totally different picture. Yeah.
Are there certain ingredients that are like banned in the US? I mean, that are banned here that are not banned in the US in terms of like health?
We very much follow the FDA. So what the FDA approves is then approved by, I'm trying to remember of our administration. Yours is the Food and Drug Administration, FDA's Food and Drug Administration. We've got the, it'll come to me, but they very much, like with any medical approval for drugs, and yeah, it's very much centred, follows the US, and they'll be looking for FDA approval to even start doing their own, I guess, approval process. So to say what's I think America's probably, we've still got stuff in circulation that America's probably taken out of circulation.
We saw like, we bought like a box of like Kraft mac and cheese, and it was a completely different like color than what we get in the US, and then I assumed that maybe there's a different dye or something that isn't allowed here that would be allowed in the US. So I don't know. That was just
I don't know for certain. So, like in terms of those processed will have very much the yellow cheeses, yeah, I don't know whether it's food additives or food colourings, but yeah, I don't have the answer. Yeah.
With like the pandemic and everything, do you think that has made people more aware, like having so much free time, like more aware of their diets and stuff, or do you think it's actually hindered and made people like overeat and be more unhealthy?
It's a great question, because my observation, and my clinic resides in the eastern suburbs, right? So I was booming in COVID when people were locked down, because there was the pandemic was circulating. Initially we didn't have a vaccine, we didn't know much about it, there were people dying, so people were very concerned about their health. It went to the top of the priority ladder, and people were saying, what can I do to improve my immune function? And they were seeking nutritionists, naturopaths, they were wanting to get into this preventative space, because medicine didn't have, the vaccine wasn't out, or we didn't have the antiviral or the stuff that could really help them, and certainly the hospital systems didn't have the ventilations and stuff like that, so it was quite scary in those early stages. So I saw an influx, I was booming. Now, and again, there was people, certainly from my observation, that either lost a lot of weight because they were now not having to commute, and hence that commuting time they'd now do exercise, right? And there was people that were putting on weight because they were stuck at home and Netflix was in front of them, the government was handing out lots of money, like you could just, there was a lot of money being circulated, a lot of handouts, and so they watched Netflix, and just Uber Eats took off, and all the Deliveroo, all that just boomed through that period. Like when I was driving around during the pandemic, you just see these bikes and motorcycles delivering food it was just crazy. You probably saw it in the States. Yeah. And so to answer your question, there was and I don't know the stats in terms of whether there is some good stats around it, but certainly there was those that put on a lot, and I'm seeing them now. And then there was those that are really proactive with their health during the pandemic and actually lost weight. Probably don't have much. They may be putting it on now because we can go out and entertain and travel. Both were happening. I would say, in terms of Western Sydney, I would say that was more like, because they were hit harder than certainly parts of the inner city. It spread a lot quicker because of the ethnic communities, and the ethnic communities are all about family, and you can imagine the size of the families, and the government's trying to say stay home. They don't, they're looking after their brother and sister and mother and dada, and no matter what the government says, they're going to do that, right? So it was spreading like wildfire in Western Sydney, and I think it was probably the other end of the spectrum in terms of they couldn't afford, so they were more harder hit in terms of their working situation, so they probably didn't have the money to invest into their health proactively, and as a result would have easily put on kilos, because it was very easy to do. It was you locked up and you had an excuse, didn't you? And in some parts of Sydney, and it was probably some parts of I think it was probably more liberal in the States, or certainly in some states within the United States. Some parts of Sydney, they couldn't go out of the house, only for medical. And Melbourne was even worse than Sydney. They had really, severe lockdown, where they could only go for medical care and whatnot. So, it was a bit of a mixed bag.
And I heard they shut down the territories as well, so you couldn't go from Queensland to like Victoria or someone, like, or New South Wales, immediately they'd shut you down, right? Like you were shut and secluded here.
Yeah. Yes.
It was scary, and I think brought on a lot of like emotional issues and, you know, feeling just trapped. And like, when you're used to being like, oh, I can take a drive from New South Wales to Queensland, no worries. But now it's like, no, you are here. This is where you are. You can't see your family in Queensland.
Yeah, so that's right. So not only interstate, so like I was in Randwick, I could only travel within 5 kilometres, 5 kilometre radius, and there'll be police policing that, and because there wasn't many vehicles on the road, the police would just see a vehicle and just pull it over and ask them, you know, have you got actually a authorised thing to leave your 5 kilometre zone, and they were issuing fines if you're outside of your 5 kilometres. And so we had a period where we couldn't go beyond 5 kilometres, and that was policed, and certainly domestic air travel was just gone, decimated. And obviously we shut all our borders, we had nothing coming in, nothing going out, and we'll just sort of, and again, I mean, there's benefits to that, and there's not so great things to that. So I guess the benefits are we could probably better contain the spread of the virus. The not so things is we might be suffering greater mental health or disconnection because we were so isolated, whereas I think in parts of the States it didn't matter what the virus was doing, you could do whatever you want, right? Yeah, like within means.
Does that help people in Australia kind of felt about the virus, like they listened, they thought it was super serious? Like in America we had two sides of it. People like, oh, this is nothing, don't care about the virus, or do what we want. And then there would be like, no, you got to get the vaccine, you got to be shut down, you got to wear your mask. Was that kind of the same here in Australia?
Yes, definitely.
Sides of the spectrum?
And extremism on both sides. Absolutely, yeah. So we had protests going here, and it was just like in the States. And but we probably noticed. I think the Australian government, like the Australian population generally is really compliant initially, but as it wore on, that compliance became less and less, and then there would become that defiance, people then wanting to defy, and because they wanted their freedom back, and so there was a massive drive, certainly in the end, to get more freedom, and the government really had to open up. Yes.
Do you guys allow like pharmaceutical companies to advertise to like the population through like television? Because I know there's only like a handful of countries that allow that, and the US is one of them, and pharmaceutical companies can take up to like 70% of all of our commercials, and I think that's like where our culture from like just like the quick like take a pill easy fix thing comes from. So I wanted to know if it was similar here or not.
Yeah, so over the counter prescriptions, yes, but well, not over-the-counter prescriptions. Over-the-counter dispensing, yes, definitely. So that means you can go into a pharmacist and you don't have to have a prescription. The ones where it's prescribed medicine, I've never seen that advertised. Yeah, so...
We have that, like, it's like every commercial,
really?
Every other commercial.
Yeah.
Go see your doctor.
Yeah.
Crazy.
So you'll see antihistamine medication advertised, but that's over the like that's you don't need a prescription for that. But certainly like for statins and things like that, and metformin, and the sort of cardiometabolic drugs that are readily prescribed. There's no advertising for that. But we have a big so we banned tobacco advertising. We banned no, alcohol's still allowed, and we've got gambling's now sort of the new tobacco. So gambling advertising's just gone through the roof. So I can see gambling probably being, but then again, the government's sort of in a catch-22 because they get a lot of revenue from gambling, and so they need the revenue in order to fund our health system. But then again, there's people that are becoming losing everything as a result of gambling.
Was gambling an issue before, or do you see it just skyrocketing now because you know, it's gambling over your phone
Yeah.
and all that.
Exactly that. Yeah, it's more accessible. Yeah, the accessibility. Like before, you had to go, you had to leave your house.
Yeah.
And go to a pub or go to a casino. Now you've just got it on an app. Exactly.
Yeah,
exactly.
in New York, they just legalized gambling over your phone, sports
Okay.
betting and stuff.
Okay.
And the amount of billions of dollars it made in the first year was just insane.
Yes, yeah, it's a big emerging issue here in Australia, and the government hasn't got they don't know how. I shouldn't. Well, they're definitely looking at it because they run anti-gambling ads, but then the anti-gambling ads are just overwhelmed with the amount of gambling ads.
Now, before you said, like, with the pandemic, health was up here, nutrition, people, weight loss and stuff. Do you see now where that's kind of fallen and mental health now is up here with
Correct.
suicide prevention and all that?
Absolutely.
Just kind of taken over.
Yes, mental health's taken over. Yeah, so there was a physical health concern, and now it's very much a mental health. It's shifted to mental health, yeah. And our counsellors are booked so far in advance, our psychologists well advanced. So the mental health system is now under, it's just, it can't cope with the demands, essentially.
Yeah, same with the States. Like, my parents were going to go through, want to see a therapist, and it took them 2 or 3 months to get an appointment.
Even on our campus therapists, they were booked weeks in advance that like students couldn't get because they didn't have enough counselors.
So
They didn't have a job.
but I think the people in the mental health service industry are now getting overwhelmed with the amount of work. They're just back to back all day for weeks, and so it's putting the pressure has now moved off the hospital system now onto the mental health system, and a lot of the funding's going towards mental health services, and Yes.
What do you think the government can do to aid, helping people eat healthier or other things? Because I know in the U.S., even to go to a nutritionist, half the time your insurance doesn't cover it, so you're paying hundreds of dollars. And I don't know if it's the same here, but if usually people that are eating unhealthy don't have the money, and then they can't, or they'll approve it if you have diabetes, but you have to get to the point of having diabetes to even get approved.
Yeah, so we have a chronic care management plan, and essentially you go and see the doctors, they diagnose you with a chronic condition such as diabetes, type 2 diabetes, and they'll obviously prescribe a metformin, and then they will say, we'd like you to see a podiatrist because we're worried about your circulation to your feet. So the government will partly fund that trip to the podiatrist. A dietitian's included in that. There's a difference between nutrition and dietitians here in Australia. So dietitians are included under the government's thing, but it's 5 visits per year. And getting back to your point, the dependency so essentially the paradigm, generally speaking, the paradigm is that health's outside of my problem. You get what I mean? It's not something that, if I need help with health, it's the government's problem. It's, external to me. And so the government should fix my problem. And so what people do do those 5 visits, and that's it for the whole year, right? So they might get a couple of stuff done with a podiatrist, a couple of dietitian appointments, and then the rest of the year they might not have the money to then get further support. And so yes, the government does fund a small portion, and then for mental health they can get up to 10 visits to a psychologist or a counsellor under the mental health care plan. So if they're diagnosed with depression or generalised anxiety or whatever, they can get up to 10 visits to the psychologist or counsellor. Again, there could be a gap payment. So Medicare will cover so much, and then the practitioner there's some that bulk bill, or you've probably heard of bulk billing. It's where you just charge what the government will cover. That's becoming less and less these days. And so there's generally a gap. But again, these people will sort of not take the onus on themselves and own their health and really look after them. And again, part of it is they're uneducated about health, and that's they haven't been provided the education through the schooling system. So it's again, it's a multifactorial issue. There's no quick fix. There's no silver bullet or a pill. Yes.
I have a question about healthcare. So how do you get healthcare here? Like, does your job provide it for you, or do you pay the government? How does it work?
Yeah, so in terms of Medicare, every Australian citizen has a right and entitlement to Medicare. So regardless, you just have to be an Australian citizen, and you get that a Medicare card. I've got a Medicare card with me. So all Australians are entitled to a Medicare card. And that Medicare card will essentially get you a doctor's appointment fully covered by the government, generally speaking, and unlimited access to the doctor. And so the healthcare system is real, and it's getting worse because, again, people take advantage of a free system. And so something, government at the previous election proposed that you'd only get 7 Medicare covered visits a year, and it was controversy, and so it obviously didn't happen. And so we still got this generally a free medical system. So the public hospitals are accessible to any Australian citizen, and it won't come to them at a cost. If you want to access the private health hospitals and the private system, then you have private health insurance, which then gives you, and again, the public system is overwhelmed and under-resourced, and so there's a big wait list for certain surgeries. With the private health system, if you can afford it, you get in straight away for those elective surgeries. But if it's anything emergency, it will just get dealt with. So you won't be waiting. You'll get that emergency treatment, that acute care, and you won't pay for it. Yeah. But with, as you saw the statistics, with the more and more of the population getting sicker, we can't fund it. We're borrowing money in order to fund our public health system and social security, and and again, it gets back to this, not owning the individuals, not owning their health, and thinking it's someone else's problem. And I think it comes down to that individual responsibility and ownership, but again, it needs to be adequately supported for those that can't afford it. So that's where the government can help out with the education. But as you know, moving and shifting these large institutions takes years, and it takes time.
Do you feel the government is doing a better job at it, or they're just kind of like doing it little by little just to kind of stay status quo, or are they doing that extra effort?
No, again, we're probably like similar to our response on climate change, our inaction around climate change, very similar to the States. It's just public health is sort of just doing enough to, and just be able to then throw out a few statistics and say we're doing something about it, and we're making a difference. But we're not like a real leading nation, certainly not. So you look at some of these nations like in Europe, they're really leading the way in terms of climate change, and even Sweden and stuff like that around healthcare and wellness, and we're certainly not one of those leading nations. We're one of the trailing nations when it comes to sustainability, environment, and health.
It's kind of funny because flying in, they're talking about all of, the sustainability of the land and all that kind of stuff. Like, you can't bring this, you can't bring this. We're all about friendliness, all this stuff. So that's kind of fun.
And a lot of the things they are.
Oh, for sure.
It's very different.
It's interesting. All right. Well, thank you so much. We really appreciate you coming in and speaking with us.
Thank you. Thank you.
Definitely learned a lot. That was really eye-opening.
Awesome. No, and thank you for your ears and your questions. Really appreciate it. So thanks.